At Salem Hospital, 96 patients have COVID. Of those, 21 are in the intensive care unit and 10 are on ventilators. Doctors like Marty Johnson, the ICU medical director, say the battle is far from over.
So it's about the same, maybe a little bit less than it was a week ago, but still way above our normal.
The hospital is caring for and sometimes losing COVID patients now that are younger than in earlier surges. September 14th, a 47-year-old died here from COVID. The day before that, a 24-year-old died. And the day before that, a 33-year-old died. It's brutal for everyone.
Oh, it's horrible. We've actually lost a 20-year-old as well at one point. Those patients, since they're relatively young and lots of times don't have a lot of chronic, morbid conditions, unfortunately, they tend to linger and battle longer in the ICU and on respiratory support.
He said nearly all those dying are not vaccinated, and many of the younger patients have other medical conditions that make them more vulnerable to the Delta variant. They also often are connected to young families.
We're dealing with oftentimes families that are more desperate. We're dealing oftentimes with very young children involved with the family. So it's very hard on the staff, very hard on everybody involved.
Despite that, there are glimmers of hope statewide. For the week of September 6th through the 12th, the Oregon Health Authority reports 12,997 new cases. That's a bunch, but it's down 11% from the week before. 592 people were hospitalized with COVID during that time, also down from more than 1,000 the prior week. And 120 people died, but the week before, the virus killed 171 in Oregon. All of it an improvement, and all of it still gut-wrenching for everyone, including the state epidemiologist, Dr. Dean Seidlinger.
Every morning, I sit with the new data from the day before. Sometimes I cry. Sometimes I get angry because much of the disease we're seeing now is preventable, and I wonder, what could I have done to reach even one more person to get vaccinated and take steps to protect themselves?
He again urged everyone to get vaccinated and bluntly spelled out the risk of not being protected from the COVID virus.
Unvaccinated people are getting sick. Unvaccinated people are being hospitalized. And unvaccinated people are dying at rates far higher than those who are vaccinated.
A sobering message that he's repeated many times. Back out live now, the state just came out today with their newest numbers just a little bit ago, 2,242 new cases. They've also reported the breakthrough cases, which is always interesting, from September 1st through the 15th. Of the 14,000 cases that happened during then, 81% were not vaccinated, so that means 19% of those cases were breakthroughs. It's about 2,600 people. They also tell us the average age of the person who had a breakthrough case was 48 years old. So it's dangerous, very dangerous for those not vaccinated, but those of us who are still not out of the woods.